What I like about 360 Care is the ability to go into nursing homes and work for patients who can't otherwise get services for their ears and to brighten their lives and make their lives better.
Hearing loss is a very isolating problem for many of these patients. They are older and they almost all have hearing losses. I've only seen a handful of patients that actually have normal hearing, and those are patients who come in for shorter terms.
The reasons why I became an audiologist was to make people's lives better, to help them hear better, and to help them function better, communicate better, have better social skills, and better interaction with their family and friends and the people that are important to them.
My ability as an audiologist is to help those with those hearing needs. I've had those patients who, until I came in there and I fit them with the hearing aids, they weren't able to communicate with loved ones. They weren't able to communicate with just those within that facility. And I feel like I'm being a part of that. I think is awesome.
The procedures that I do are a lot of rumen management, a lot of talking to people about hearing aids. This is an elderly population. They basically all have hearing loss. Many of them have put off getting a hearing aid because of the cost.
And the types of procedures that I've done so far are standard comprehensive audiometry, admittance measures, cerumen management, ear mold impressions for ordering hearing aids, and clean-in checks, hearing aid clean-in checks.
Luckily, 360 uses the best audiometer and equipment. I can easily tote it around. Once I get everything loaded and put together in the cart, I head out to my destination.
They provide me with really good equipment. I have a great audiometer, I have a great tympanometer, and they have provided me with all the supplies I need. So those aren't things that I need to think about.
At 360 Care, I have autonomy. I am Dr. Peavy. I'm treated as a doctor, capable of making my own decisions about how to treat a patient, whether to refer them out or to handle a problem myself.
Being able to work independently is important to me. It's one of the things I like about 360 Care. I'm able to develop relationships with patients, with the staff that I interact with, and with the 360 employees as well.
And being an independent contractor, it works extremely well for me because I have another full-time job. You know, I'm a wife, I'm a mom, so I am able to be flexible with my time. I'm able to still do what I love to do, but I'm able to organize that around everything else I have going on.
I can make decisions about cerumen management. I can modify testing procedures. I can make decisions about the proper amplification use, and assistive device use. So I really like that I can make those decisions for each individual patient.
Working in nursing homes does provide some challenges. Patients are not as movable oftentimes as working in a normal clinic setting. It is an opportunity to be creative and find different ways to be able to help these patients.
Some of the challenges that I have found are just kind of not knowing where you're going to be in terms of setup, not knowing the health and the orientation of your patients.
One thing that I will say, and this is from my heart, is that if you do have a challenge, it's just an opportunity to grow and to dig deeper. And if you think you're spent and that's all you've got, well then so be it. But I think most people would be surprised that they do have more to offer. And being flexible and rising to the challenge, that's something that at the end of the day you can feel good about.
A provider at 360 Care is going to be someone who is really happy with the flexibility, with the autonomy, with the ability to work one-on-one with these patients and see them over a period of time and get them hearing better and understanding about their disability, fitting them with the hearing aids, and working with the nursing staff to allow them to provide the support care they need to make these patients hear better, and then they're more productive in their environment.
I think the providers that tend to be the happiest are the ones that really want to help people. We like to counsel people. I think we like to teach people about their ears and about how to take better care of their ears, how to take care of their hearing, how to prevent hearing loss, the things that could cause more hearing loss that they need to avoid.
Being able to see the patient, see the difference that I'm making, and hopefully they can tell that, hey, audiology is an important career, it's an important contribution to a person's overall well-being, because if you don't hear well, you cannot process well. If you don't process well, you don't recall well, and you feel very isolated, and it can lead to depression and other problems. So I feel like audiology is a great career for me, and I hope I've given back to it.
Helen Keller once said that blindness separates you from things and deafness separates you from people. And the quality of our lives are dependent on our connection with others, and I want to keep that connection going.